Yeah, yes, we are good to go, and the link is online. I have given the YouTube link also, so that will be shared to you by our principal sir.
Good morning, everyone. I would like to start the day with the quote, "Let food be your first medicine and kitchen be your first pharmacy." A hearty welcome to all for today's 7th National Webinar on Tackling Mysterious Viruses and their related health issues. How prepared are we? Organized by Ayur Suraksha, Bangalore. It's a great privilege to welcome Dr. Vijay Lakshmi Deshmani, former Director, Kidwai Cancer Institute, Bangalore, and Dr. Geeta Vishwanathan, former Professor of Zoology, St. Joseph College, Bangalore, founders of Ayur Suraksha. With immense pleasure, we would like to welcome today's guest speaker, Dr. Girish H.C., Professor and Head of Department of Oral and Maxillofacial Pathology, RR Dental College and Hospital, Bangalore. A warm welcome to the organizing and scientific team, Dr. DVSSR Prakash, Principal, Administrative Management College, Dr. Shashi Chowdhury, Trainer and Educationalist, New Delhi, Dr. Shamala Karnam, Associate Professor, RR Dental College, Bangalore, Dr. Guru Siddesh, Bangalore, Dr. Shweta, Faculty Member, NPS, Bangalore, Mr. Mohan, Bangalore. I would like to extend warm welcome to all scientists, academicians, students, research scholars, and faculty members for the webinar. When darkness comes, let us not condemn the dark, but light a lamp to illuminate. Now, we will start the day with our traditional auspicious lamp lighting ceremony as a tribute to Mother Saraswati, the goddess of knowledge. I request our Honorable Principal, Dr. DVSSR Prakash, Dr. P. Sudharani, HOD of Department of Biotechnology, Professor Rajesh Kumar, Director, Hotel Management Department, Mr. Ranjan Narlashetty, Commerce Department, to join for lighting the lamp and symbolically inaugurate this program. And Mr. Abhijit Chatterjee to join for lighting ceremony. Gnana Sudha Sagari Shankari Sharade Brahmanarani Kamala Nayani Veda Bhashini Subhashini Manohari Sukomale Sarasavani Navani Gnana Sudha Sagari Shankari Sharade ओंकार रूपिणी श्वेतावर्णधारिणी श्रीकार रूपिणी शुभ मंगल देवी नेलसन्न नालिಗೆಯಲಿ अनुदिन अनुक्षण अभयವ ನೀಡಮ್ಮ सप्त स्वर सागरी ज्ञान सुधा सागरी शंकरी शारदे गान सुधामये ಜ್ಞಾನದಾಯಿನಿ ಅಂಧಕಾರದ ಜಗಕ್ಕೆ ಕಾಂತಿಯ ನೀಡಮ್ಮ ಶೃಂಗಪುರದೀಶ್ವರಿ ಆರಾಧ್ಯ ದೇವತೆ ಭಗವತಿ ಭಾಗ್ಯವತಿ ಭಾಗ್ಯವ ಕರುಣಿಸು ಜ್ಞಾನ ಸುಧಾ ಸಾಗರಿ ಶಂಕರಿ ಶಾರದೆ ಬ್ರಹ್ಮನ ರಾಣಿ ಕಮಲ ನಯನಿ ವೇದಭಾಷಿಣಿ ಸುಭಾಷಿಣಿ ಮನೋಹರಿ ಸುಕೋಮಲೆ ಸರಸವಾಣಿ ವೀಣಾವಾಣಿ ಜ್ಞಾನ ಸುಧಾ ಸಾಗರಿ ಶಂಕರಿ ಶಾರದೆ It's my great privilege to introduce Dr. D.V. SSR Prakash, Principal, Administrative Management College. Dr. Prakash Duhuri is a person with enthusiasm, keen interest, and eye for details in planning, design, and execution of work, a flair for multitasking, and an enormous personal drive to excel in challenging tasks. Dr. Prakash Duhuri is MSc, Botany with Cytogenetics and Genetics specialization from Osmania University, Hyderabad, and PhD Life Sciences, Plant Biotechnology, Tissue Culture and Genetics from Devi Ahilya University, Indore. He has qualified GATE and NET examinations, presented research data and papers in national and international conferences, and published original research articles in national and international journals of high repute. Dr. Prakash Duhuri was selected and awarded with several prestigious awards. Dr. Prakash Duhuri developed skills of editing scientific literature, and he has edited 10 volumes of Encyclopedia of Nanotechnology and writing books on biotechnology, microbiology, related areas for the benefit of scientific community. He has worked as chairman, Board of Examinations for Biotechnology UG. He is a lifetime member of several scientific and professional bodies like Association of Biotechnology and Pharmacy, and fellow of International Society for Biotechnology and Karnataka Cancer Society, Bangalore, Karnataka, and well versed with preparation of institutional data for inspections, affiliations under BU, AICTE, and accreditation procedures of NAC and NBA, etc. Presently, Dr. Prakash Duhuri is principal of Administrative Management College, Bangalore, and his focus is to implement quality policy for assessment of AMC. Now, I request our beloved principal, Dr. D.V. SSR Prakash, Administrative Management College, to address the gathering. Over to you, sir.
Good morning to one and all present and attending this virtual seminar, that is the webinar organized by Ayur Suraksha, the 7th national webinar on tackling mysterious viruses and their related health issues. How prepared are we? Respected founders of Ayur Suraksha, Dr. Geeta Vishwanathan, former professor of zoology, St. Joseph's College, Bangalore, and Dr. Vijayalakshmi Deshmani, former professor and head, Kidwai Cancer Institute, Bangalore. The guest speaker for today's webinar, Dr. Girish HC, professor and head, Department of Oral and Maxillofacial Pathology, and vice principal of RR Dental College and Hospital, Bangalore. Dr. Seshi Chaudhary, trainer and educationalist from New Delhi, and close associate of Ayur Suraksha and regular visitor, and attended all the previous 6 seminars at Bangalore, and she has been keenly interested in developing this Ayur Suraksha and associated with the group. Dr. Shamala Karnam, Associate Professor, RR Dental College, Dr. Shweta, Dr. Guru Siddesh, Mr. Mohan, and Dr. P. Sudharani Madam, the head of the Department of Biotechnology, Administrative Management College, and Ms. Pavitra, Assistant Professor, Administrative Management College, Department of Biotechnology, and all the members of Ayur Suraksha, invited scientists, galaxy of academicians, researchers, and group of students from different colleges and universities presenting their lectures and students. Good morning and welcome to the 7th National Webinar on Tackling Mysterious Viruses and their related health issues, How Prepared Are We?, being organized by Ayur Suraksha, Bangalore. Ayur Suraksha is a brainchild of Dr. Geeta Vishwanathan and Dr. Vijayalakshmi Deshmane, established 7 years ago. Under this banner, it was intended to train students for research in the frontier areas of biotechnology, biochemistry, life sciences, and cancer research, organize seminars, conferences to inculcate training in the related fields and impart knowledge related to genetics and focus on holistic development of human race. Briefly, I would like to introduce the founders of Ayur Suraksha. Dr. Professor Geeta Vishwanathan was a UGC professor at St. Joseph's College, Bangalore, and into teaching and research for the last 4 decades. Her main area of research work was in the field of medical genetics. She has many honors to her credit, like Recognition Award from Bangalore University, Gold Medal, Vidya Jyoti Award, Vidya Bhushan Awards from various universities. She has International Award of Excellence and Dr. S. Radhakrishnan Award for Education from International Holistic Medical Association, Sri Lanka, and was an invited keynote speaker in several conferences in US, UK, and UAE. Her field of interest is in the use of alternative therapy of improving the lifestyle for better health and especially to manage the special children like autistic children. Her field of interest is also into Indian Vedic tradition, culture, and its scientific approach. We welcome you, madam, for this webinar and hope you're fine at your place. Dr. Vijayalakshmi Deshmane is a renowned oncologist, is the professor and head of the Department of Surgical Oncology at Kidwai Memorial Institute of Oncology, Bangalore since 1983, and contributed for the development of the institute till 1990. With MS in general surgery, she was also conferred with the degree of Doctor of Science, extensively traveled to Sweden, Sri Lanka, UAE, and USA for medical and scientific collaborations. She was awarded with several awards by international scientific societies for her human contribution to the field of medicine. Dr. Vijayalakshmi Madam is known for her honesty, integrity, sincerity, and commitment to the work. She is relentlessly working with missionary zeal for bringing awareness on breast cancer among women. We cordially invite you, Madam, for this webinar. Another important person for us, Dr. Shashi Chowdhury, is a practicing psychotherapist, trainer, and author. Her 30 years of experience in training with the will to awake the minds of each individual for change resulted into the culmination of her best-selling book, Talk to Heal, The Art and Science of Telecounseling. She imparts the art of learning to the learners, skills of teaching to empower the teachers and ensure to create the conducive environment for bringing the best in children in schools. Her plethora of experiences in the areas of educational research, training and development has resulted valuable contributions to the different stakeholders worldwide. The synthesis of knowledge, the diverse therapies and healing process provide her with the perspectiveness which is uniquely, truly to hers, that is Dr. Shashi Chowdhury. Several seminars have been organized from 2014 onwards, national seminars, to name the titles: Cancer Causes and Prevention in 2014, Lifestyle Change and Increasing Cancer in Society, 2015, Stress Impact on Health, 2016, Impact of Digital Gadgets and E-Waste on Life and Health, 2017, Ancient versus Present Lifestyle, Impact on Health, 2018, understanding the role of genetics and epigenetics in cancer in 2019. These were the seminars organized for the last 6 years. This year, the title is very well known, Tackling Mysterious Viruses and Their Related Health Issues, How Prepared Are We? The present situation of COVID-19 has come as a sudden disaster worldwide. It is an unexpected event and unforeseen situation. We have to swim with the situation. There is no other go. COVID virus, and as you are all aware, most of the viruses are host specific. This particular virus is human specific. Then how prepared are we? Certainly only the social distancing, the cleaning, using masks, these are the preparedness, but there is no a sign of vaccination maybe in near future, next 6 months, that's what the reports say. One is vaccination, its acceptance, clinical trials, ICMR acceptance, drug control in the country, then clinical trials in different areas, South India, Central, North India, and public-private partnership, how the private companies are vigorously working on the research of this particular aspect. So many questions are there and so many unanswered questions still they are prevailing. So in this situation, awareness about this by eminent people and also training the youngsters to face the challenges related to the viruses and the diseases. That is only the way to train the people. And with this, I invite all the people for this webinar and also the guest speaker for today's webinar. Thank you very much.
Thank you very much, sir. Now I request Dr. Vijay Lakshmi Deshmani Madam to address the webinar.
Good morning. Can you hear me?
Yes, ma'am.
Can you hear me?
Yes, ma'am, you're audible.
Yeah. Good morning. All the best wishes for the webinar. Very beautiful topic is chosen. Hello?
Yes, madam.
Audible?
Yes, ma'am, you are audible.
Can I go ahead?
Yes, yes, ma'am. You can go ahead, ma'am.
Good morning. All the best wishes for the webinar. You have chosen a very beautiful topic. I think we get a lot of information today. Please start the program. Please maintain the distance. Mask is a must. Thank you. Thank you.
Thank you very much, madam, for sharing the awareness about COVID-19. It gives me immense pleasure to introduce Dr. P. Sudharani, HOD, Department of Biotechnology, AMC College. She has done MSc in Life Sciences and PhD specialized in endocrinology from Sardar Patel University, Gujarat. She has qualified in GATE examination. She has a teaching experience of more than 20 years. Her area of interests are immunology, animal biotechnology, and medical biotechnology. She has guided many MSc, MPhil, and PhD students. She is a member of BOS and BOE in various universities. She has also worked as a chairperson, BOE, under Bangalore University. Now, I would like to invite Dr. P. Sudharani to give introduction on mysterious viruses. Over to you, madam.
Very good morning to everyone present here. It gives me immense pleasure to extend a warm welcome to 7th National Webinar on Tackling Mysterious Viruses and their related health issues. How prepared are we? The objective of the webinar is to understand what is virus, virus-host interaction, viral diseases, and the role of immune system. We live in a microbial world, which means that we constantly encounter microorganisms that could harm our health. Viruses can infect everything from plants and animals down to the smallest bacterium. For this reason, they always have the potential to be dangerous to human life. Once a virus infects a cell, it tries to take over its host completely, much as Napoleon spread the French language with every country he fought. A virus lodged in a cell replicates and reproduces as much as possible. Left unchecked will cause the death of the host cell. However, this is not true for all viral infections. The viruses may persist in a cell without damaging it and make the cell a carrier. The patient may appear to be cured, but the infection persists and can spread to others. In addition, the infection may reappear later after a period of latency. Viruses cannot exist on their own, and for survival, they need to spread to another host. This is because the original host may either die or eliminate the infection. In addition, in order to spread, the viruses also need to withstand the immune system. A special category of viruses is those that cause disease only when the immune system is deficient in some way. These are called opportunists. And opportunistic infection is one of the main problems in patients. The body's first line of defense against viruses is the innate immune system. This is made up of cells and other mechanisms that defend the host from infection. This provides a temporary protection against the viral onset. Once within the adaptive immune system, immunity faces the virus and remembers it. This is a more permanent form of immunity that may last a lifetime against a particular strain of virus. Specific antibodies are produced against the virus. This is called humoral immunity. Two types of antibodies are important. The first is called IgM, is highly effective at neutralizing viruses, but is only produced by the cells of the immune system for a few weeks. The one that lasts a lifetime is the IgG antibodies. The second line of defense is called cell-mediated immunity and involves immune cells known as T cells. T cell recognizes a suspicious viral fragment and the killer T cells destroy the virus. Viruses in general are notoriously difficult drug targets as they modify and adapt themselves rapidly to build up a resistance against the drug. With this introduction, I would like to extend a warm welcome to Dr. Girish, HC, guest speaker for today's webinar. I am sure that we will feel enriched with immense knowledge after his lecture. Thank you for giving me this opportunity.
Thank you.
Now, I request Dr. Shamla Madam to take over the session. To introduce the guest speaker. Over to you, Madam.
Thank you. Thank you, Pavitra. Leader is one who not orders, but shows the path by walking on it. One such person is our Girish sir. He's our boss, rather a very friendly boss. He has done his undergraduation in the year 1994 and his PG in 2000 from Bapuji Dental College as an oral pathologist and a best outgoing student. He was also, he is an excellent oral pathologist. He is now the professor and head of Department of Oral Pathology, and he's been in this profession around 19 to 20 years, both UG and PG teaching experience he has got, with a patent to his name now. And at the college level, he has served as NAC coordinator, PG director, and now he's the vice principal of Rajarajeshwari Dental College, and a very good one. And he's a fine oral pathologist, as I have already mentioned. With that, he's an excellent clinical practitioner as well. He has a very good dental practice in Basveshwar Nagar, and he is very encouraging to students. He has been an excellent teacher throughout. Students love him a lot. Along with that, he has been the best employee of the year in 2014 and 2016. He is an active member of Indian Association of and Oral Maxillofacial Pathologists. He's a member of Indian Dental Association. He has numerous national and international publications in a peer-reviewed journal, in prestigious journals to his credit. With all that, he's a loving colleague, I must say, because it's very hard to find a person like him who walks the talk, who keeps him very grounded. With him, working is a pleasure. So I really am glad to introduce you all to Dr. Girish Hetsi. I welcome him to take over the stage. Thank you so much, sir, for accepting our invitation. Thank you, sir.
Thank you. Thank you. Thank you for that wonderful introduction of mine. Is my screen visible?
Yes, sir. It's visible.
Yes?
Yes, sir.
Yeah. Okay. I thank the organizers of Ayur Suraksha for giving me an opportunity to talk about the overview of COVID-19 situation. And a special thanks to my colleague, Dr. Shamla, for introducing me and in a, what to say, very, I am not so great as she told, but in okay. Just a minute. Okay. So I begin with my one of the quotes here. The more I read, the more that I know nothing. So with this small introduction, I will begin with the overview of COVID-19 situation. Okay, when I thought of beginning this webinar or presentation, I was thinking about how to start this webinar. So I came across this picture of wheel. Okay, so probably the invention of wheel is one of the most important invention for a mankind. So without wheel, civilizations would not have developed. We would not have traveled places. We would not have met people. Even though it took a lot of time to refine the wheel, but now we have come to a state where we were so busy in traveling and meeting people that suddenly everything stopped from March 2020. You can't believe that there were 3 flights every minute touching down at Bangalore International Airport, or 3 flights that were taking every minute from the international airport. So such was the situation about how we were going around. But the pandemic has put a full stop to all these things. So mankind is not new to pandemics. We are also not new to such epidemics also. So when I go back to the history of pandemics, the first reported pandemics which killed people on large scale was the bubonic plague of 14th century. It is believed that it was one of the worst pandemics in the history of mankind. And later, it was the Spanish flu around 100 years ago, which started from Kansas in America and spread throughout the world. We share a little, what to say, same history with the Spanish flu as well as COVID-19. Both are virus and both are airborne. Okay, and even Spanish flu had a lot of mortality rates, and it took 2 to 3 years for the pandemic to settle down. So we are already completing 1 year in the COVID-19 pandemic come this December, and we hope by another 6 months to 1 year we may get the vaccine and there will be an end to this pandemic. So as I have told you, 2019 we have ended up with this pandemic known as the COVID-19 pandemic, which is caused by this coronavirus. So this coronavirus is nothing but an RNA virus which has got a single stranded RNA, and it has caused such a loss of life throughout the world that we are still not able to control it. So it all started in December 2019 when many people in Wuhan, China started getting admitted to hospitals for an atypical pneumonia. So there were a lot of cases of pneumonia, and the reason for this pneumonia was not known. Then it believed that this was a virus which is from the zoonotic origin, that is, it has come from an animal. So zoonotic means which has come from an animal, not human to human transmission. But now once it has come to human, now human to human transmission is possible. So till now we have 44 million confirmed cases of COVID-19 and around 1.17 million deaths. And out of 197 countries, 188 countries have been affected by this disease. So such is the spread of this disease when it comes to, it is crossing all borders, whether it is America or the tiniest island in the world. So as you all know, this spreads through small droplets and aerosols. So when an infected person breathes or coughs or sneezes, this virus spreads through these droplets and aerosols, and ultimately it is taken up by persons who are in the vicinity. People are infectious for up to 2 days in mild cases and up to 2 weeks in severe cases. So there is a lot of difference between droplets and aerosols. So what is an aerosol and what is a droplet? Because we need to know what a droplet is and what an aerosol is, because whenever we are saying to wear mask, this is the reason behind why people are being asked to wear masks. Aerosols are liquids or solid particles which are less than 5 micrometers in diameter, whereas droplets are more than 5 to 10 micrometers in diameters. The problem with aerosols is these aerosols are so small, they can be suspended in air for half an hour to 3 hours if an infected person sneezes or coughs. So this is where the risk for another normal person comes. If he walks through that aerosol, the likelihood of him getting infected is more, because the normal nose can filter up to 10 micrometer of dust particles or otherwise, but bacteria is around 1 micron, and the viruses are still smaller. So there is an all possibility that this aerosol which contains these viruses are inhaled by a normal person, and the chances of him getting infected is more. So droplets are they are more heavier and tend to settle down. They settle down much easier, but the problem is they can go to a distance of more than 6 feet. Okay, so droplet and aerosols are the biggest challenges now what we are facing, because these are the ones which are causing havoc by spreading to persons. Now, this is one of the photo which I got from the internet, which shows an high-speed photography wherein a sneeze can blast saliva and mucosa up to 6 feet. Okay. Now, it is believed that when a person coughs, the speed of these droplets is up to 50 miles per hour. And when a person sneezes, the speed of these droplets and aerosol is up to 100 miles per hour. So sometimes they can reach up to 6 feet and they can be suspended in air for up to 3 hours. So coming to what are the common symptoms that people get? They include fever, cough, fatigue, that is the generalized tiredness. Fatigue is nothing but generalized tiredness, breathing difficulties, and loss of smell or taste. So why does people with COVID have loss of smell or taste? I will come to it later, but it is believed that there is a receptor known as ACE2 receptors. Okay, that is where this coronavirus is going to lock into the cells which has these ACE2 receptors, and that is why these receptors are found around the nerves more, and that's why the inflammation caused by this virus leads to loss of smell and taste. So 10 to 20% of patients may require ICU admission. Okay, they may need oxygen support or they may need ventilator support. And incubation period is usually around 1 to 14 days. So what do I mean by incubation period? So whenever a person is exposed, he may get the symptoms of this disease within a day or two, or it may extend up to 14 days. So that is what is known as incubation period. So the period between exposure to an infection and appearance of the first symptom is the incubation period. So currently there is no specific treatment for this actually. It is only symptomatic with few antiviral drugs and steroids. And of course, vaccine is under various stage of clinical trials. Around 20 companies all around the world are in various stages of developing vaccine, and some are in stage 3 clinical trials. But I think it will take another 6 months to 1 year to actually come to market. So there are a lot of risk factors when it comes to COVID-19. So the risk factors include old age. Okay, obese patients have more chances of getting admitted into ICU, hypertension, diabetes, people with chronic respiratory disease. So all these persons have more riskier than the normal population. So what is this COVID-19? So COVID-19 is a virus, as you all know. It's an infectious agent which grows in cell of another organisms. As Madam has told, all viruses require a host so that they can replicate. So these viruses are usually either DNA viruses or RNA viruses. Basically, RNA viruses are more than the DNA viruses, and they are also susceptible for recombination process. So what is recombination process? You may have different strains of COVID infected in the same individual, and these different strains of virus may come together to form another strain, which is known as recombination process. So it is believed this COVID-19 has got similarity with the SARS, which occurred in 2002-2003, and this SARS of 2003 originated from bats. It is believed the SARS-CoV-1 was basically among bats, and later it, through an intermediary animal mammal, it came to humans. And it is suggested that they have around 85% of genetic material which is identical to SARS-CoV-19 COVID-1. So there are many different coronaviruses. Basically, you can classify coronaviruses into 4 types: alpha, beta, gamma, and delta. Basically, alpha and beta infect mammals, whereas gamma and delta infect humans. Okay, so most of the cases of coronavirus, they cause common cold and a typical syndrome of running nose and malaise. Okay, and this is easily transmitted across species. As I was telling, this COVID-19 has got some amount of familiarity with SARS, which occurred in 2002-2003. And this SARS basically originated from bat, and the intermediary host was palm civet, and later it got infected to humans. And in 2012 and 2013, there was another viral infection which was known as Middle Eastern Respiratory Syndrome. So this Middle Eastern Respiratory Syndrome also originated in bat, but the intermediary host was camels. And this MERS was most commonly seen in United Arab Emirates and in the Middle East. And later on, from camels, it came to humans. And in 2019, we have landed up with COVID-19 or the SARS-CoV-2, and its origin is also from bat, but the intermediary host is believed to be pangolins, and from pangolins, from the wet market of Wuhan, it has come to humans. So this is a chart that depicts how the viruses has spread from bats, basically. So the 2002 SARS came from bats. The cross transmission occurred through palm civets, which are traded in live animal markets in China. And from there, it went on to have a zoonotic transmission to humans, that is, transmission from animals to humans. So again, this later went to the patients had a nosocomial transmission, that is hospital to healthcare worker transmission, and also hospital to general population transmission. So this was about the SARS-CoV 2002. And in 2013, as I was talking about the MERS, again, the origin of this virus was from bats, and it got transmitted through camels and again to the general population. SARS and MERS, they were actually more fatal than COVID-19. If you go back to SARS, the fatality rate was around 17%, and the MERS fatality rate was around 33%. Only thing, the difference between COVID-19 and the other viruses or COVID viruses were they needed lot of viral load, okay, and their transmission was not so great when you compared with COVID-19. They needed more amount of viruses to enter and cause symptoms, but whereas COVID-19, the viral threshold or the viral load threshold is very less, and so what was supposed to be an epidemic in China went on to become a pandemic, and it has brought the world to a standstill. So this is the structure of coronavirus. There are 4 structural proteins which are very, very important. And the first is the spike protein, the hemagglutinin glycoprotein, the membrane glycoprotein, the small envelope protein. They all encase a single strand RNA. Why I am showing you this picture is because this spike glycoprotein is one of the most important aspect in the structure of coronavirus, because this spike glycoprotein is the one which is going to come and attach to an ACE2 receptor of the humans. We will go to the next slide to understand how exactly it happens. So if you go back, you have the SARS-CoV-19 attaching to what is known as then ACE2 receptor. So this ACE2 receptors is linked to SARS virus through the spike glycoprotein, and then it is imbibed into the cell, and later on this virus takes over the control of the cell and starts replicating itself. Once a virus takes control of the cell, it replicates exponentially, and it gives on the virus from these cells to other cells, and the process repeats, and within a very short time the viral load increases so much that it is very, very difficult to treat the patient. So this is another picture of again how this SARS-CoV spike protein is getting attached to these ACE2 receptors. And once the viral entry, replication, there is down regulation of the ACE2 receptor, and this causes acute lung injury and heart muscle damage, and increases vascular permeability and a host of other things. And we can relate this to the signs and symptoms of the patient. Now, where are these ACE2 inhibitors? Receptors. So these ACE2 receptors can be found in the nasal epithelium, in the lung epithelium, in the ileum, heart, eye, liver, bladder, kidney, and brain, prostate, and pancreas. So basically you have ACE2 receptors throughout the body, but they are more concentrated in the nasal and the lung epithelium or the alveoli. So once the COVID-19 gets attached to these ACE2 receptors, they are internalized, and then the replication starts. So this is a slide to show where all we have these ACE2 receptors. So coming to routes of transmission, there are 2 important routes of transmission. One is through droplets and droplet nuclei or the aerosol, and second is direct contact. So as I have already told you, an infected individual, if he speaks, droplets or an aerosol, which will travel up to a distance of 6 meters, and it can get suspended in the air for up to half an hour to 3 hours. And so if a normal person inhales these droplets or droplet nuclei or the aerosol, they get lodged into the normal person, and then the virus is inborn. That's why the basic method of prevention of this pandemic is to wear a mask and to maintain social distance. But all say that social distancing of 6 feet, but now it is believed that these droplets can travel up to 6 meters. Okay, and another mode of transmission is through direct contact. So we have all avoided handshakes. We have sanitizing all the handlebars and other things. Why? Because this is how we can prevent the spread of the infection. Now, coming to what are the symptoms of coronavirus? First, the is fever. You can see fever in around 87% of the patients. Dry cough is next, which can be seen in around 68% of the cases. Fatigue in 38%, and shortness of breath and other things, which are very minimal. But each patient is different. Each patient can come in some other form. He may come with just nausea, vomiting, or diarrhea, and fever may not be there. It depends on the doctor who is treating him to properly diagnose. But basically, patients with coronavirus have these two common symptoms, that is fever and dry cough. All fevers and dry cough is not COVID. You have various other viruses which can cause same amount of fever and dry cough. So it is a table to compare what are more common in COVID-19 in cold and flu. So it is up to the treating doctor for him to check the symptoms and come to a diagnosis. Now, patients have been classified. The COVID patients have been classified according to how they are. The first one is the suspected cases. The second one is the probable case. And the third one is the confirmed case. So what is a suspected case? So suspected case is someone who shows clinical signs and symptoms but has not been laboratory tested. I think we have lot of suspected cases in India. Many people who have shown signs of clinical signs and symptoms of COVID, but they have not been laboratory tested. Next is the probable case, wherein a suspected case has come in close contact with another COVID positive patient, and that's why they are classified as probable cases. This is where your app, Arogya Setu app, will help you in determining whether you are a probable case. Okay. And lastly is the confirmed case, wherein a person has been confirmed as COVID positive, has undergone an RT-PCR, and it is a laboratory confirmation of COVID-19 infection. So this is basically the clinical classification of COVID-19 patients. Patients can also be classified based on the symptoms. Okay. Majority of COVID-19 patients are mild cases. They constitute around 81% of all cases. They include mild fever and fatigue. Okay. And they don't require any hospital admission. They are usually self-quarantined at home. Okay. Next comes to severe cases. This constitutes around 10 to 15% of the cases, and they where the oxygen saturation falls below 93%, and that is when you need hospital admission. There will be shortness of breath, there will be less oxygen saturation, and that is where you require hospital admission and oxygen support, and it depends on how the patient progresses. Okay. And lastly, the critical cases, wherein patients have suffered respiratory failure, they need ventilator support, and they are going for multi-organ failure. These critical cases constitutes only 5% of cases. So there is nothing to panic as such, but It depends on individual to individual. So we have to be careful, but at the same time, panicking is not the solution. So as I have told you, 80% or 81% of patients are usually mild. They does not require any hospitalization. Isolation at home is enough. Around 14% require hospitalization. They may require oxygen support or ventilator support, and around 5% needs ICU admission. They are the ones which are very critical, and this picture of 5% going around the world is what is causing panic. So I was talking about risk factors earlier. So there is a direct relation between the risk factors and the ACE2 receptors, what I was talking before. Race, it is believed that East Asians have an more amount of ACE2 receptors than in other population, and that's why it is believed the coronavirus or the COVID-19 is more among East Asians than in the other different population. It is also believed that these receptors increase in age, and probably this is what provides an explanation for increased severity in old patients. And it is also believed that ACE2 receptors are more in males than in females. That is why when you take the hospital records, it shows that 75% of the patients are males and around only 24 or 25% of patients are females. Why? Because males express more amount of ACE2 receptors, and that's why the chances of the spike protein or the virus getting attached to these receptors is more. And as the infection rate is more among males, the death rate or the mortality rate is also more among males. So 86% of the patients had comorbidities. So what do I mean by comorbidities? Comorbidities are one, patients having other diseases like diabetes, hypertension, heart and kidney disease, or it can be any even cancer can be a comorbidity. So what do I mean to say is patients with comorbidities should be very, very careful because they are immunocompromised. They have more amount of ACE2 receptors. The chances of getting COVID-19 is more among them. Coming to case by age, you can see that it is more in 21 to 40 years of age, and it declines over a period, but the severity of COVID-19 increases with age. So that is the problem. It is believed that more older patients are going in for ICU admissions than the younger patients. So if you look at this graph here, you can see that the mortality rates increases as the age increases. So the mortality rate gradually increases from the 5th, 6th, 7th and the 8th decade. The 8th decade has got the highest mortality rate of around 15%. And as the age is less, the mortality rate is also less. So comorbidity, age, sex plays a very, very important role in the clinical outcome of the COVID-19 virus. So why obese people are more prone for infection and why the mortality rate is more? It is believed that these fat cells or the adipose tissue or the visceral fat tissue has got abundant amount of ACE2 receptors, and that's why more amount of virus, the chances of more amount of virus getting locked into these ACE2 receptors is more. And most obese people may require ventilator support. And as I have told you, people with comorbidities are have got a more amount of serious conditions. So coming to diagnosis. How do you diagnose COVID-19? These are all the clinical symptoms which I was talking about. How do you diagnose COVID-19? First is the travel history, especially to the endemic countries like China, Iran, and Italy. These were the hotspots when this pandemic started. So travel history is one which will help you in coming to a diagnosis. Complete blood picture, because you see less amount of white blood cells, less amount of lymphocytes in around 30 to 40% of the patients, and lymphocytopenia in around 85% of the patient. Chest X-ray and chest CT scan, very, very important in COVID-19 patients, because they are giveaway. The diagnosis can almost be confirmed with a chest CT scan. Okay, it is got a specificity rate of around 85%. Okay, so how doctors are diagnosing COVID-19 with chest X-ray and chest CT scan is because the radiographic features in these are different. You have what is known as a ground glass appearance. There are a lot of opacities in this chest X-ray, and that is how it is helping doctors to come to a diagnosis. And of course, PCR is the gold standard for diagnosing COVID-19 virus. So these are some of the images of the chest radiograph. You can see the characteristic ground glass opacities, which gives which is a giveaway for a diagnosis of COVID-19, and also the CT findings, which has again got ground glass opacity and the crazy paving pattern, which is called as the crazy paving pattern. So these are some of the adjunct with RT-PCR where you can come to a diagnosis of COVID-19. So management, how are you going to treat COVID-19 patients? Currently, there is no specific treatment for COVID-19, but of course, you have a lot of antiviral drugs being tried out. There is a cocktail of antiviral drugs that is being tried out, but some of them have clicked, some of them have not. So basically, it includes antiviral therapy, corticosteroids, and antipyretics. And of course, a lot of symptomatic treatment, oxygen support, ventilator support. So these are some of the antivirals that is being tried out. So nothing actually is specific, but it is only a symptomatic treatment. So prevention is the best cure. So as I have told you, this coronavirus can spread through two ways. One, droplet infection or aerosol infection, and with physical contact. So if you are wearing a mask, that is going to help a lot in preventing coronavirus. And if you maintain social distancing, that is also going to help the prevention of coronavirus. So there is also a lot of studies going on what type of mask you should wear. Okay, it is believed that surgical mask, which most doctors are wearing, is not sufficient enough to prevent this inhalation of coronavirus. So when the viral load is more, it is advisable for healthcare workers to compulsorily wear N95 masks, because the virus is less, the diameter of the virus is less than the what a 3-ply mask can give. So this I have already talked about. The droplets can go up to 10 feet, and it can get suspended for up to 3 hours. So you should always maintain social distancing, and also you should cover your face. Wash hands as frequently as possible when you go out. So this is a slide which shows how can you reduce the risk of coronavirus infection. Washing hands, covering your mouth and nose when coughing and sneezing, and thoroughly cooked meat and eggs, and avoiding contact with anyone showing flu-like symptoms and avoiding these wild animals trading. So what is the road ahead for us? So the road ahead for us is one, vaccine. It is the most promising thing what we have learned till now, that vaccine will be available from 6 months to 1 year. There are other treatment modalities being tried out, that is the natural killer cell therapy, mesenchymal stem cell therapy. Mesenchymal stem cell therapy is also showing lot of promise that it may be one day treatment protocol in treating this COVID-19, immunotherapy and monoclonal antibodies. But among all this, vaccine is one which we are eagerly looking forward. For all pandemics to end, there are two ways. One, vaccine, or development of what is known as herd immunity. So what is herd immunity? That is sufficient number of people get infected and you develop immunity against the virus. So this is how a pandemic can end by these two ways. So how to prevent the future spread? When I say future spread, it is not that coronavirus is going to go away. There are a lot of reports. If you go to newspaper now, they say that it is coming down. The incidence of coronavirus is coming down. But if you read the paper in Europe, or if you go to England, they are in second lockdown. From today, England will be shut for 1 month. So there is always a second wave and a third wave which is going to come. It is common in all pandemics. So this is common. It will come definitely for sure in COVID-19 also. So how to prevent such things from happening, or how to prevent a pandemic from another virus coming? So first and foremost, all illegal wildlife and wet markets should be banned, because that is where SARS, MERS, as well as this COVID-19 came. They all came from bats, and it has infected humans, and it has caused much suffering. People never thought they will be in such a situation. Okay, travel restrictions and quarantine is very, very essential. It is the need of our. Of course, we have travel restrictions and quarantine, but you know how people are. They are simply not following it, and I think the more amount of cases will again rebound in late November. So vaccine development is the need of the hour. It will be more prophylactic and therapeutic. So it is the only hope for us in combating or preventing coronavirus. And reporting of diseases and strict enforcement of quarantine and lockdown rules should be there. Otherwise, again, as I've told you, the second wave or the third wave will be more severe. And especially in our country like India, corona positive is there is a stigma attached with people being corona positive. That should go. It can happen to anybody, and it can happen to you and me also, but it is not the end of the story, because people have come out of the infection, and that stigma should go. And lastly, supplying immediate necessities to the infected areas should be ensured. I believe when this pandemic started, many people, even healthcare workers, doctors, did not have a proper N95 mask in many areas, leave about the PPE kits. So such necessities should be available whenever there is a epidemic, so that it can be contained in that particular area itself. So these are the 5 steps to be taken to prevent further spread. So I'm concluding this webinar with this. It is not the end. Everything will be fine. It is only a matter of time. So let us hope this ends soon, and we come back to normal as soon as possible. So through these pandemics, these are the ones who take us through the pandemics. You all know how these 6 months were. We were all locked down in our homes. Okay, we had time for everything, time for films, time for music, time for family, and we had a very good time. So I came across this saying from Eric Pevernage. It says that it is the poets, artists, and musicians that will carry us through the pandemic attacks into the new reality. And they are the ones who will tell us how to navigate, feel, think, enjoy, and fully live our lives. Okay. Thank you very much for giving me an opportunity to speak about this. I hope have done justice for all the time you have spared with me. And I thank the organizers of Ayur Suraksha, especially Dr. Shamla ma'am, my colleague, for giving me an opportunity to speak about this. Thank you.
Thank you so much, sir. It was an excellent, comprehensive view on COVID-19. I'm sure all our students and the other delegates are really being used, helped by this. You have covered every part of it, especially the prevention part. You mentioned excellently well. Along with that, an assurance that you ended with, an assurance that you're all going to be safe, it's really helpful. You have enlightened on so many matters of COVID that actually we were not very aware of. And this was an excellent presentation. So thank you so much for accepting and helping to serve. Thank you. I will pass on the stage to Pavitra.
Yeah.
Thank you, Pavitra.
Thank you very much, sir, for fascinating us with a detailed review on COVID-19. Now we will have the presentations by students. Now I'll announce the sequence of the participants and I request all the participants to be ready. First, Harshita, Aditya, Athanu Das, Mishika Arora, Rajini, Vandana N, Prakruti, Pramati PR. The time limit given for each student will be 6 + 2 minutes. Now, I'll call upon Harshita.
Good morning, ma'am. Am I audible, ma'am?
Yeah, you're audible.
Okay. Thank you, ma'am. Ma'am, is the screen visible?
No.
Just a minute. Sorry for the delay. Ma'am, is the presentation visible now, ma'am?
Yeah, it's visible now. You can carry on.
Okay. Ma'am, I'll start the presentation now.
Yes.
Good morning to everyone. I'm Harshita, intern from RV Dental College. I will be presenting a short-term research titled Natural Plant Dyes, an alternative to eosin in histopathological staining, which is guided by Dr. Sarita Y, Department of Oral and Maxillofacial Pathology. My co-presenter will be Aditya Keshav. I'll be presenting under the following headings. Need for study. We all know that histopathology is the gold standard method for most of the lesions. An important step in this is hematoxylin and eosin staining to visualize the different tissue architectures. Hematoxylin, being a basic stain, will stain the acidic nucleus in purple color. Eosin is acidic stain and it stains the cytoplasm in pink color. Eosin also gives varying shades of pink to different types of tissues as seen in this section, which gives us better understanding. Now, our main focus in the study will be for eosin, which is a cytoplasmic stain. It is synthetically obtained from petroleum products. Its main disadvantage being expensive mostly in developing countries. The other main disadvantage is that of health effects. There are many studies which have shown that it is an eye irritant and has allergy to the skins. It also has effects on environment where there is toxic effects. It's a toxic waste. It has disposal issues, and it has shown to reduce the fertility of soil. All this will lead us to find an environment friendly, sustainable, and environment economical alternative to eosin. There are many other studies which have shown such replacements in this direction. Many cytoplasmic stain replacements have been studied over the years, such as bougainvillea, ginger, turmeric, and henna. But in our study, we have particularly chosen hibiscus and beetroot as it has vibrant colors. It is commonly found in our country. It has similar color to that of eosin. It's natural and economical. Moreover, it is not studied much as stains in oral tissues. Therefore, our aim is to determine the efficacy of hibiscus and beetroot as alternatives to eosin for the purpose of histopathological staining in oral tissues. These are the literature that we reviewed. The main objectives of our study is to stain paraffin embedded tissue sections with various concentration of aqueous solution of hibiscus and beetroot. Also to determine the best concentration among 5, 10 and 20% of both hibiscus and beetroot. These are the armamentaria we used. Mainly, the main components that we used are commercially available powdered extracts of hibiscus and beetroot, from which we obtained 5, 10 and 20% hibiscus solution and beetroot solutions. These are the materials we obtained from online sources. Now, in previous studies, they collected the raw materials, dried it, and then powdered it to obtain the solutions. But we procured the powders from online platform. The advantage of this being accurate processing. The methodology, as is a histopathological comparative study design which involved purposive sampling. The samples were collected from gingivectomy blocks obtained from Department of Oral and Maxillofacial Pathology in our college. We conducted the study for about 3 months. The inclusion criteria involved the gingival tissues with adequate epithelium and connective tissue components, which were obtained from regular routine procedures such as extractions, crown lengthening, and gingivectomy. We did not include the tissues with inadequate connective tissue component. The sample size, we selected total of 15 cases or 15 blocks, and these blocks each were divided into 7 sections, giving us a total number of 105 sections. We triple blinded the study. The plan of action was as such: for each concentration, that is 5, 10 and 15% of hibiscus and beetroot, we gave a sample size of 15, and for control group of HND stain also we gave 15 sample size. This is the protocol of our preparation of solution. We also tried the alcoholic solutions of 5, 10 and 20% solutions for both hibiscus and beetroot, but it resulted in sedimentation and evaporation, that hence not used in study. We got 5% aqueous solution only. The staining protocol we had was very similar to the HND staining protocol, but one major step of ours was inclusion of beetroot and hibiscus solutions for cytoplasmic stain. We made it for a lot of timings, that is from 10 minutes to 60 minutes.
Hello,
we section, ma'am.
Just this one, 6 minutes over, last 2 minutes left.
Yes, ma'am. So these are the methodologies. We also observed the stain sections under 10 and 40x under the assessment criteria for epithelium and connective tissue. The trained oral pathologist also graded them. These are the statistics we used. The results and discussion. In previous studies, alcoholic solutions were not used, and in our study also it led to evaporation. Aqueous solution only was possible. Let us compare the contrast. These are the sections that we obtained, out of which the 40 minutes was the best. For beetroot, these are the sections, out of which 30 minutes was the best. Let us compare the contrast. In previous studies, with 10% solution, it showed good quality staining in 60 minutes. Whereas in our study, for 40 minutes, we had the best stain for hibiscus, and for beetroot, we had for 30 minutes. The other noteworthy points that melanin pigment and basement membrane were not clear. Also, we tried to observe muscles and nerves, but it was not present in gingival specimens. The staining ability of our stains, when we saw the slides again at 36th and 48th hours, the stains started to deteriorate and the solutions also started to deteriorate over time. The summary is we have pros and cons. These are the pros. These are the cons. We intend to follow the following points to solve the crisis we found. Ethical consideration. The study did not require any investigation or interventions to be made on patients or humans. Therefore, I conclude by saying, to our best knowledge, that our study is one of the first kind to demonstrate the use of both hibiscus and beetroot in oral tissues. And hence, alternatives can be done for these stains, and a lot of further standardization is required. So until we establish standardization, we can leave the beetroots to kitchen and hibiscus to the gardens. These are our references. We would like to thank the following members. Thank you.
Thank you, Harshita, for an excellent presentation. It's very important that we have alternative chemical, a very natural alternative to the processing tissues. This is a total histopathology topic, so for the others to know. It's just
Thank
that
you, ma'am.
chemicals are dangerous, so we go on the natural methods. So this is a good one. Thank you so much.
Thank you, ma'am.
Thank you, Harshita. Now we'll move to the next participant, Aditya.
Aditya Keswana. Is the you can tell. Tell Aditya.
Aditya, are you ready? I request Aditya to unmute and start the presentation.
Aditya is having a technical issue, it seems. So he'll be there in 2 minutes, he's saying.
Okay. So shall I move to the next participant, ma'am?
Yeah, you can go with the next participant.
Okay. So now we'll move on to the Atanu Das.
Good morning, ma'am.
Good
Thank you
morning.
for giving me the chance to present. Now I would like to share my PPT.
Yeah, please.
Ma'am, my screen is visible.
No. Yeah, now it is visible. Your screen is visible. Yeah, carry on.
Okay, thank you. Myself, Atanu, student of Rajarajeshwari Dental College and Hospital. Today I would like to present about COVID-19 and its prevention. Today I should focus on the background, international and national situations, risk factors and severity, spread of the virus, treatment and vaccine, and fighting of the same. It is the of the novel coronavirus disease. Is the name of that virus which causes COVID-19. Severe acute syndrome and medial respiratory syndrome are the main causes. COVID-19 is a new coronavirus disease that is emerged from the Hubei that is present in China and December 2019. The immediate risk to the general public is very high in India and other countries.
Not changed anything, is it?
International and international situations. Total 44.6 million cases are confirmed in 216 countries, among which 30.1 million cases got recovered till now. In India, it's 8.5 million cases and 7.32 million cases got recovered till now. Risk factors and severity. People with COVID-19 can have no symptoms or may develop mild, severe illnesses like cough, fever, other things. Kids may have diseases. Risk factors for severe illness may include older age and underlying chronic medical conditions. Virus spread of the virus primarily spreads through person to person respiratory droplets from coughs and sneezes, possibly spread by touching an object or surface with a virus on it, or touching the mouth, nose, or eyes. It takes approximately 2 to 14 days for an infected person to show the symptoms. People may likely most infectious while they are most symptomatic. Spread from the asymptomatic persons also possible. Treatment and vaccine. No specific treatment currently available. Supportive management of complications include advanced organ support is indicated now. Antiviral medications are under investigation and development stages till now. Risk assessment. Serious public health threat has reported in United States, India, and other countries. Strategy is now to prepare the healthcare system and general public. Better characterize the infection to guide the public recommendations and development of medical countermeasures, including diagnostic, therapeutics, and vaccines. Global circumstances suggest exactly that the virus is a pandemic. Strategies and criteria. Personal strategies are home isolation of ill people, hand hygiene, respiratory etiquette, and home quarantine of ill potentially exposed people. Social distancing is also a major case. School closures and dismissal should be there. Social distancing in workplaces should be there. With fever, cough, or difficulty breathing have traveled from other states in the last 14 days. Ill with fever, cough, and difficulty in breathing and having the public health as recent close contact of common COVID-19 case or had recent close contact with someone who is being evaluated for COVID-19 infection. Procedures for the student or volunteer and others. Move them to the private room away from the others and ask them to wear a face mask. Immediately notify local health department for the guidance and treatments. Recommendations for students, staff, and other members are stay at home away from others and monitor their health for 10 days. If you develop symptoms during the 14-day period, have contact with others and your families. Call the doctor or healthcare provider to update about the symptoms and recent travel. Prevention measures. Need not to take special precautions, just wash your hands with the alcohol-based sanitizers and the hand washes. Encourages students and others to take the precautions, perform frequent hand washing with soap and water, avoid touching eyes, nose, mouth frequently with unwashed hands, cover coughs, sneezes with a tissue, and then throw it to the trash or clean dustbins, and then clean your hand and wash your face. Provide adequate supplies for good hygiene. Follow your routine cleaning and disinfection program. Prevention is better than cure is always followed all the guidelines. Protect yourself and help to protect others from this deadly virus. Thank you.
Thank you, Atanudas, for the making the effort to present. It's very nice. Thank you.
Thank you. Thank you, ma'am.
Can we have Aditya presenting now?
Thank you, Atanudas. Now we'll move to the next participant, Aditya.
Yes, ma'am. Am I audible?
Yeah, you're audible. You can go ahead.
Right. Just a minute, ma'am. Ma'am, I'm not able to share my screen. Can someone please give me access to share my screen?
It is Aditya Kesu, right? Yeah. Now please try, Aditya.
Yeah. Just a minute. Is my screen visible?
No, you did not share it yet.
Unable to understand. My screen visible now?
Yes, yes, yes.
Good morning, one and all. I'm Aditya Keshav, intern from RV Dental College and Hospital. I'll be presenting on the topic Natural Mimics for Formalin as a Fixative, a comparative study. The study was carried out in the Department of Oral and Maxillofacial Pathology of our college and was graded by Dr. Sarita. My co-presenter will be Dr. Harshita. I'll be dealing with this topic under the following headings. The need for the study, right?
Excuse me, Aditya. Sorry for interrupting you. I think you can turn your mobile so that we can see your screen a bit bigger.
Yes, yes, sure.
Yeah, in horizontal way.
Yeah.
No, that's what. Yeah, this is good. This is good.
Yeah. The need for the study is basically because histopathology, as we all know, is the gold standard for diagnosis of lesions. And the first step after biopsy is fixation, for which we need a suitable agent. And by and far, the best is 10% neutral buffered formalin. which is proven to be an excellent fixative from the 19th century. But of late, we have started to realize that formalin has its harmful effects. And what are these harmful effects exactly? Formalin vapors causes irritation, burns, nausea, ulceration, pharyngeal congestion. It's also a class 1 carcinogen according to the IARC, and it causes distortion of certain features such as masking of antigens, making immunohistochemical studies difficult. It is also difficult to extract genetic material from these samples. Also, the disposal of formalin is a big problem, and standard methods cannot be followed due to the lack of infrastructure in many places. And this leads to environmental pollution. Now, why honey and jaggery? According to Codes Alimentarius, bees honey is said to have fixative properties at par with formalin, while jaggery, owing to its similarity in composition with honey, can be used as a fixative. Also, very few studies have been done, most not on oral tissues. The results have been widely inconsistent. These alternatives are environment friendly and cost effective. And hence, my aim and objective was to test the efficacy of jaggery and honey as natural alternatives to formalin in oral tissues, with the objective of determining their properties as a fixative, to compare the nuclear and cytoplasmic staining after hematoxylin and eosin staining, to compare the immunohistochemical staining of honey, jaggery, and formalin fixed tissues. During the review of literature, we use the following keywords with this search strategy. We reviewed about 10 articles, out of which these 4 articles were found to be our key articles. The armamentarium includes all of this, with the most important being the first 3, that is formalin, 10% neutral buffered, the 30% organic jaggery solution, that is 30 grams in 100 ml of water, locally obtained in Bengaluru, 20% processed honey solution, that is 20 ml in 100 ml of water, commercially available honey was used. The rest is the routine armamentaria used for histopathological tissue processing. Our methodology was a double-blinded cross-sectional coded study in D.A. Pandu Memorial Avi Dental College, Bengaluru, for a period of 2 months on patients undergoing routine procedures with a progressive sampling technique. 15 in each group, 30% jaggery, 20% honey, and 10% neutral buffered formalin. We included only normal oral mucosa specimen obtained from patients undergoing routine extractions, crown lengthening, or gingivectomy procedures. These specimens that measured less than 1 centimeter in length, tissues which were very thin and friable, and pathological tissue samples were avoided. The tissue sample so obtained was divided into 3 equal parts and assigned a unique code. Group 1, the tissue sample was fixed in 30% jaggery solution for 24 hours. Group 2 was fixed in 20% honey solution for 24 hours, and group 3 fixed in 10% neutral buffered formalin for 24 hours. All these tissue samples were processed, sectioned, and stained with hematoxylin and eosin. All 3 sections observed under the light microscope, assessed and graded by 2 observers, trained histopathologists. We graded the tissue samples based on the following criteria, that is epithelial preservation, connective tissue preservation, connective tissue details, cellular outline, nuclear details, and staining quality, with scores being assigned from 0 to 3, 0 being poor and 3 being excellent. We did a statistical analysis after the assessment of the sections using the crystal values ANOVA for all criteria individually and for the overall quality of the specimen, with a significance value of P less than 0.05. These are our results, and you can see that only 2 criteria, the values were significant, that is connective tissue details, where we found formalin was the best to preserve connective tissue, and the staining quality, where honey, the tissue sample stored in honey showed a better staining quality than that shown in formalin. So the first thing, you can see how well the tissue has been stained in sections stored in honey and jaggery, while there is a dull staining with that stored in formalin. This is the cellular outline of the cells of the tissue sample stored in all 3 sections. You can also see the epithelial and connective tissue preservation, where there is marked distortion in the sample stored in honey and jaggery, whereas formalin has less or less distortion. This is significant. You can see the connective tissue details. Many samples stored in honey and jaggery, 6 out of 10 in honey and 5 out of 10 in jaggery, had an epithelium and connective tissue split, whereas this was intact in formalin. So the positives of this study was there's great staining quality, excellent visual of cellular outline and nuclear details. While we have more negatives here, epithelial preservation was not remarkable. The split was seen, connective tissue distortion was seen, molds develop in solution if thymol crystals are not added. Jaggery solution thickens post 24 hours, and dark color of jaggery solution makes it difficult to locate the tissue in the solution. Analysis, we took this study based on 4 pre-existing studies, which concluded that jaggery is better than formalin, but the results have been varied in our study, and this could have been because of the small sample size. Standardization of material has to be carried out. Adulteration could be a possible cause, and pH control was not established. In conclusion, I'd like to say that these materials do provide as viable alternatives for formalin, given their plus points, but they should be further validated and standardized before they can be introduced into full-fledged practice. For now, formalin is best used in the histopathology lab, while it is better to leave jaggery and honey to sweets in the kitchen. These are my references. I'd like to acknowledge the following people. Thank you.
Thank you. I'm glad that DAPM RB Dental College is sorting to a lot of natural alternatives to the chemical processing technique. I'm glad. Keep up the good work. Thank you.
Thank you so much, ma'am.
Thank you, Aditya. Now we'll move to the next participant, Mishika Arora. Ma'am, is she ready?
Yeah, Mishika will be presenting through my screen itself. So I'll be sharing the presentation once again.
Okay.
How do we see? All of you are able to see the screen?
Yes, ma'am. We can.
Over to Vishika.
It is rightly said by Hippocrates that nature is the best physician. Good morning to one and all present here. Today I, Dr. Mishika Arora from Rajarajeshwari Dental College and Hospital, will be presenting my research paper of the topic, Assessment of The topic of my research paper, assessment of antimicrobial potential of 30% ethanolic papaya leaf extract against Candida albicans and Enterococcus faecalis, which is an in vitro study. So, the advent of multi-drug resistance among pathogenic bacteria is endangering the worth of antibiotics, which had formerly transformed medical sciences. Antimicrobial resistance presents a severe worldwide threat of budding concern. Now you might be wondering, why am I suddenly talking about antimicrobial resistance? Let me explain. So, antimicrobial resistance occurs when microorganisms gain the ability to resist the effects of a medication that once could successfully treat the microbes. As a result, the standard treatments become ineffective, infections persist, and may spread to others. Antimicrobial resistance is a big threat for our society right now. Comes into the story the hero, green dentistry and green medicine, which are Mother Nature's expensive jewels. It is an advanced way of central practice which is environment friendly and at the same time saves money and time. It minimizes waste, conserves energy, and reduces pollution with the use of latest techniques and procedures. It is a high technology methodology which decreases the environmental impact of dental practices in moving forward to an ecologically sustainable healthcare system. So, Ayurvedic medicine was considered to be one of the world's first medical system that was invented in India, dating back over 1,000 years. Since very few studies were carried out on the efficacy of papaya leaves against oral microflora, I chose to study this topic in detail. Carica papaya or papaya has been claimed as anti-ulcerogenic, anti-amoebic, antifungal, antimicrobial, anti-tumor, hypolipidemic. It also implies in wound healing. It has scavenging activity, diuretic activity, uterotonic activity, and anti-fertility activity. It is itself a hero in its name. And the organisms that we chose for the study were Candida albicans and E. faecalis. Candida is the summarized name used to describe a class of fungi, which is also a beneficial flora. It has some advantageous purposes as in the body as well. But candidiasis or oral thrush is an imbalance and overgrowth of Candida albicans. E. faecalis, on the other hand, has been linked to many oral diseases like periodontitis, caries, endodontic infections, and periimplantitis. The aim of this study is to assess the antimicrobial potential of 30% ethanolic papaya leaf extract against Candida albicans and Enterococcus faecalis. So the materials used in the study are displayed as here. Now I'll go ahead to explain the method of the study. This is an experimental study which was carried out for a duration of 2 months and was approved by the Ethical Committee in Rajarajeshwari Dental College and Hospital. The steps followed to obtain 30% ethanolic papaya leaf extract are: the first step was collection of papaya leaves. Then the papaya leaves were dried in a hot air oven at 40 degrees Celsius until they were completely dried. The next step was processing of papaya leaves in the Socklets apparatus with 70% ethanol. You can see the pictures of the process that we had done. This was to distillation for 2 hours. After that, dry extract, 40 degrees Celsius. The dried extract was then used for antimicrobial activity after sample was finally prepared by dissolving in dimethyl sulfoxide. So this is the final extract, the last picture, and this was taken in the lab. All these pictures were taken in the lab during the procedure. The culture media used were Luria bertini agar media for E. faecalis and potato dextrose agar for Candida albicans. So these were the culture medias used, and after that, you can see the zone of inhibition. The zone of inhibitions can be observed in the following pictures along with the minimum inhibitory concentrations. The zone of inhibition test for 30% ethanolic papaya leaf extract showed an inhibitory zone of 15 mm and 13 mm. 15 mm for E. faecalis and 13 mm for Candida albicans respectively. In relation to the control, which was 0.2% chlorhexidine and fluconazole, it was observed that the zone of inhibition was 10 mm and 11 mm for E. faecalis and C. albicans. So the control had an inhibition zone of 10 mm for E. faecalis and 11 mm for Candida albicans, but the papaya leaf extract showed an inhibition zone of 15 mm for E. faecalis and 13 mm for Candida albicans. The study showed that Candida albicans becomes resistant after a minimum inhibitory concentration of 5%, and E. faecalis becomes resistant after the minimum inhibitory concentration of 2.5% concentration. This is how the minimum inhibitory concentration was tested. So the study showed excellent results because of the therapeutic values of medicinal plants that lies in its various chemical constituents. So the constituents of papaya that helped in getting such excellent results were flavonoids, alkaloids, and saponins. Flavonoids, which are reported to have antimicrobial and spasmolytic properties, alkaloids, which have antimicrobial properties again, and saponins for cytotoxic effects. This study was first of its kind, where 30% concentration of ethanolic papaya leaf extract along with positive control was used to test microorganisms in order to compare efficacy of ethanolic papaya leaf extract. It is indicative that the test extract used in our study has shown more antimicrobial potential than the control used in the study. So this is the discussion, and we have compared it with other studies. And so for the 30% ethanolic papaya, where we saw 15 mm of zone of inhibition, the comparison could not be done to any previous study because this is the first of its kind. However, further studies are recommended as clinical and field settings to assess its practical and economic feasibility and to recommend its use in clinical setting. Now, I would like to conclude the topic by adding that rather than being dependent on chemicals and drugs which have innumerable side effects, why not we go back to our ancient ways of taking from the nature and healing our bodies? I would like to quote that the doctor of the future will give no medicine but will interest his patients in the care of human frame, in diet, and in the cause and prevention of disease. These are my references. In the end, I would like to thank my co-authors and guides, Dr. Padma Bhatt and Dr. Anjan Ji, for giving me this opportunity. I would also like to thank Dr. Shamla for giving me this platform to present today. Thank you.
Thank you, Mishika, for an excellent presentation. I'm glad to say that our younger generation is really looking for natural phenomenon. That's very glad. Thank you so much.
Thank you, Mishika Arora, for the nice presentation. Now we'll move to the next participant, Rajini. Is she ready?
Yes, ma'am. I am ready. Good morning, everyone. Ma'am, can I present my presentation?
Yeah, please.
Yeah. Ma'am, can you able to see my presentation?
It started sharing. Not
Yes.
able to see. Not able to see yet. Yes. Now it is clear.
Okay, ma'am. Good morning, one and all present here. My name is Rajni from RRDCH. I am studying second year, and my co-partner, Miss Anuja from second year, Rajarajeshwari Dental College. We are here to present our interested topic regarding genomics and proteomics in dentistry. Here we are going to present based on genomics and proteomics that plays a great role in dentistry according to periodontitis and heart ischemic. So let's move on to the topic. These are my abstracts. Abstract, genomics and proteomics have promised to change the practice of dentistry and oral pathology, allowing the identification and the characterization of risk factors and therapeutic targets at a molecular level. However, mass-scale molecular genomics and proteomics suffer from some pitfalls like gene-protein interaction, gene-gene interaction, gene-protein interaction, and protein-protein interaction. The proper analysis of this complex picture requires the contribution of therapeutic disciplines like bioinformatics and data mining. In this world, we have a lot of therapeutics that we come across. But if we start doing according to genomics and proteomics that can be involved in dentistry, it will be very useful for all the doctors and researchers to diagnose all the diseases and disorders that troubles the patients, so that we can get back the disease and disorders to a normal level, or else we can also prevent from those diseases. So particularly data mining of existing information could become a strong starting point to formulate new targeted hypotheses and to plan ad hoc experimentation. In this review, advantages and disadvantages of the above mentioned disciplines and their potential in oral pathology are discussed. The leader gene approach is a new data mining algorithm recently applied to some oral disease and their correlations with systemic conditions. The preliminary results of the application of the leader gene approach to the correlation between periodontitis and heart ischemic at a molecular level are presented for the first time. Okay. These are the main topics that we are going to go through today: genomics, proteomics, and metabolomics. Genomics. We all know that genomics have promised to change the practice of dentistry, the complete sequencing of the human genome. The development of mass-scale research tool in this field, such as DNA microarray, has greatly improved. DNA microarray can be used to measure the relative gene expression in different conditions, example normal versus pathological tissues. For instance, recent studies have employed microarray technology to monitor gene expression in periodontal patients. Proteomics. Proteomics deals with the identification of the protein produced by cells in normal and diseased conditions. Metabolomics. Metabolomics monitors the role of small molecules like lipids, sugars, and amino acids involved in daily cellular function. So basically, the potential role of these disciplines in the study of oral biology and pathology appears immediate. For instance, proteomics of saliva can be used to evaluate the disease progression in periodontal patients. Okay. Let's go with this basics into the topic of periodontitis. Periodontitis is a gum disease. It is a chronic inflammatory disease that is triggered by bacterial microorganism and involves a severe chronic inflammation that causes the destruction of the tooth supporting apparatus and can lead to tooth loss. It can also lead to other health problems. Periodontitis always begins with inflammation of the gums, known as gingivitis. This inflammation usually involving reddened or swollen gums and bleeding when brushing teeth or biting of food. It is the body's response to bacteria that have been allowed to accumulate on the teeth. The inflammation can then spread to below gums and along the root of the teeth. This can cause permanent damage to the tissues or periodontal ligament around the teeth and to the supporting bone. And to loosen and can eventually be lost. So these are the normal tooth structure and periodontitis root structure. The word periodontitis comes from periodontium, which means surrounding. Peri, the tooth means odont. The periodontium includes all the components that hold the tooth in the jawbone. The gum, the normal gum, the anchoring fibers, the bone, and the anchoring structure on the surface of the tooth root called cementum. In a healthy tooth, the periodontium surrounds the entire root. Symptoms. Periodontitis always begins with inflammation of the gums, known as gingivitis. One of the first signs is that your gums bleed when you brush or brush your teeth. The gums may look red and swollen, and you might notice a discolored layer of bacterial plaque on the teeth. If not removed through proper cleaning of the teeth, this plaque will become mineralized, turning into hard deposit known as calculus or tartar, which cannot be removed by a toothbrush. Increased bleeding from the gums, which may be provoked by tooth brushing or eating, or may be spontaneous. The symptoms may be bad breath, changes in the position of the teeth in the jaw, teeth appears longer, pain. In smokers, gum bleeding may be less noticeable. This is because of the effect of nicotine on blood vessels and means that the progress of the disease may be hidden. Gingivitis is an inflammation that is limited to the gum line, while in periodontitis, there is loss of jawbone, periodontal ligament, and root cementum. In gingivitis, there is not yet any loss of the structure that hold teeth in place. This means that good oral hygiene at home can stop the gingivitis and restore healthy gum. But with periodontitis, it is different. Once the inflammation has caused bone loss, this damage cannot be repaired. Treating the periodontitis requires more than good oral hygiene at home. It needs professional care from a dentist or periodontist. The severity and spread with which periodontitis progresses depends on factors including the number and type of bacteria present on the teeth, the strength of an individual's defense, the presence or absence of risk factors like smoking, diabetes, genetical factor, the main types of medications. For example, the more aggressive the bacteria and the weaker the immune response of the patient, the more active will be the disease. And if the patient is a smoker or has diabetes, the body's defense may be weakened, which can speed up the disease process. Some drugs, such as antihypertensive or vasodilating agents and immunotherapy, can affect the inflammatory response to plaque and make patients more susceptible to gingivitis. But it is very important to remember that without the accumulation of bacterial plaque, periodontitis will not occur. Consequences of periodontitis. There are 5 or 6 types that affects us, like tooth loss, bad breath, problems with eating, negative effects on general health, problems with speaking, problem with appearance. Periodontitis has been linked with more than 50 diseases and conditions, including chronic kidney disease, Alzheimer's disease, rheumatoid arthritis, and certain types of cancer. Periodontal ligament fibroblast. Protein expression has been studied using immunological method, although this technique is limited to previously identified proteins for which specific antibodies are available. A total of 117 proteins has been identified from PDL fibroblast, which can serve as a reference map for future. In this study, as well as basic research, periodontal diseases are still worldwide human disease or problem, resulting in a high level of morbidity and an economic burden to the society. Proteomics offers a new approach to the understanding of holistic changes occurring as oral microorganisms adapt to environmental changes within their habits in the mouth. Porphyromonas gingivalis is a periodontal pathogen, is known to undergo a transition from its commensal status in healthy individuals to the highly invasive intracellular pathogen in human patients suffering from periodontal disease. Extensive proteomic research is done on T. gingivalis. Diagnosis. Saliva is considered as an important periodontal diagnostic tool since variable amount of blood, serum products, GCF, electrolytes, epithelial and immune cell microorganisms, bacterial degradation products, polysaccharides, bronchial products, and other foreign substances are present in whole saliva. A direct cause and effect relationship for a specific gene defect and periodontitis susceptibility can be illustrated.
Rajni ma'am, sorry for interruption.
Yes,
time limit is exceeded, so I request you to sum up.
Okay, ma'am, I'll just do it.
Sum up quickly.
Yes, yeah. So there are lots of genes, for example, matrix metalloproteinase and lysosomes, and many are there which can affect this, which helps us to diagnose this periodontal diseases. So mutation of the cathepsin gene responsible for HMS syndrome, and at least a portion of prepubertal periodontitis cases. And it is also related to heart ischemic research has been going on regarding periodontitis and heart ischemic level gene, which interconnects this common defect to pass on. So there are lots of methods, and in this session we are just seeing about the protein measurement and bioinformatic measurements. So these are the charts. Like you can see here, NFKB1, a nuclear factor of kappa-like polypeptide gene enhancer in beta cell 1, and NF in heart ischemic also you can find it out. NFKB1, nuclear factor of kappa-like polypeptide gene enhancer in beta cell 1. These plays a major role and acts as a leader gene in this disease. So these are the interaction maps of leader genes within the periodontitis and heart ischemic. So correlation between the human periodontitis and heart ischemic at a genomic level, a data mining study has been taken up. So there are 225 genes. Yes, ma'am, involved. So let's go for the conclusion. Personalized medicine will provide treatment based on the genetic makeup of an individual by taking into account genetic variations which are noted in a particular disease for that particular patient rather than standardized treatment for every patient. Translation of this research in a clinical setup will make it beneficial for the patients as well as the clinician in early diagnosis and treatment planning. So it is advisable that if healthcare professions are exposed early to research and technology, this clinical implications of various disease will be channelized better, thus making application of research into clinical practice. Thank you so much. And the references are from Revati Deshmukh and Priya Nishik Dio. Thank you so much for giving me this opportunity. Thank you, ma'am. Thank you, Shamala ma'am, Dr. Shamala ma'am.
Thank you, Ranjini and Anuja. Good insight into proteomics and genomics. This is a platform for young scientists to come forward with their ideas and to learn also presentation. So I think you'll learn a lot during these processes. Thank you so much for taking part.
Thank you, ma'am. Thank you so much, ma'am.
Thank you, Ranjini. Now we'll move to the next participant, Vandana N. Are you ready?
Yes, ma'am.
Yeah.
Ma'am, should I share my screen or will the PPT be shared, ma'am?
You have to share your screen.
Okay, ma'am. Ma'am, is my screen visible, ma'am?
Yes, ma'am. It is visible.
Very warm good morning to one and all present here. Myself, Vandana, representing Vivekananda Degree College. My presentation is on the topic impact of heavy metals to the biological system of humans in the commercially available kebab powders.
Vandana,
So,
go to
yes, ma'am.
slideshow. Go to slideshow. Your presentation is. Go to slideshow here, this corner. Yeah. Go there.
So should I present?
Yeah, go to slideshow. From current slide, you can go to.
Yeah.
Continue.
Yeah, Mamba. So kebab powder is a non-veg masala powder which is mainly used in the preparation of kebab to increase the taste, color, aroma, palatability of the food. This kebab powder is a combination of many spices like cloves, cinnamon, garlic, etc. So these spices are mainly used. These are a part of ingredient. So the main objective of our study was to estimate the concentration of heavy metals in the commercially available kebab powder. So this initiation was given by our guide because he has already done contamination of heavy metals in turmeric powder. So this initiated us to go on research with this. So as we all know that Karnataka is a agricultural state. It has many values. In that food also plays a major role to show our tradition. But this fast foods which have come nowadays are putting back our olden foods. So this may be also this also contributes. This also has a major contribute for contamination and health disorders. So from our study, we observed the concentration of the following metals like zinc, nickel, copper, manganese, cobalt, and heavy metals like lead, cadmium, molybdenum, and rubidium. so our samples were collected from the local markets of Rajaji Nagar, Bangalore. So we collected the samples as I've shown in the picture here. Our samples were collected in that packets, and it was examined by an instrument called as XRF, that is X-ray fluorescence method. So this instrument mainly works on the principle that when atoms are radiated to X-ray, they start emitting secondary X-rays. So these rays are called as fluorescence radiation. As we all know that X-rays, it normally range from 0 to 11 nanometer. So all the metals in that range were identified by that instrument. So now the present slide shows the concentration of heavy metals in the collected samples. We may observe that from the slide, all the metals exceeds, except zinc, all the metals have exceeded the permissible level, which are guided by WHO and FDA. So this shows that the kebab powder are contaminated with heavy metals. Now I'd like to move on to discussion. Contamination usually occurs accidentally. No one purposely does that. It may happen accidentally, like by use of irrigation water or soil during a manufacturing process, or during industry in the industries. So contamination may occur by this following factors. Our metals were classified by two categories: essential metals and heavy metals. But we observed that the essential metals, few were above the permissible levels, and the more essential metals were below the permissible level. This shows that they are not making a proper powder that is necessary for us. And we also observed the concentration of lead and cadmium, which are very, very dangerous for all the children, because we know that kebab is a most found food for the childrens, and even the youth are very much fond of this kebab, as it is most of the favorite food of them. So this concentration of lead and cadmium is also been observed, which is very much dangerous for the health. Now I would like to move on for individual metals. Like first one, zinc. Zinc is a necessary element for health immune system. But this zinc in our concentration was from 11 to 26, which is below the permissible level. This shows that the zinc deficiency is being caused. So the zinc deficiency mainly affects the brain, thalamus, skin, and reproductive system, and this mainly what affects our growth metabolism, and it is also affecting the bone metabolism. So moving to next, iron. Iron is most essential metal, which is necessary for the production of blood in our body. But here we saw that iron was in excess amount than the permissible level. We know that the permissible level of iron according to WHO and FDA is 300, but here we found that it ranged from 120 to 600. So this shows that iron is excess. So excess of iron mainly causes gastrointestinal diseases, and it also results in loss of kidney. Next, moving on to next metal, it's copper. Copper is mainly required for the defensive system, and it mainly plays a major role in the immune system. But in the collected samples, we found that copper was less than the permissible level. We can say that it causes deficiency. So deficiency causes Meng's disease, cardiovascular diseases, and it also affects the metabolism of bones, as copper is very much necessary. Next, moving on to nickel. Nickel mainly plays a major role in bone strengthening, and it helps in blood cell production. So it ranged from 0.7 to 0.8, but it was more than the permissible level. Excessive level of nickel causes kidney stones, and it also affects our system. Neurological system is mainly affected. Next, moving on to manganese. Manganese is is not much necessary for our body. It's required in small amount, and it's already in the body. But in the samples we observed that it ranges from 70 to 120. It is above the permissible level. So as the level of manganese increases, it may cause diabetics, and it results to hypothyroidism, and it affects the reproductive system, and it also causes and it also affects our metabolism. Next, moving on to heavy metals. Among the heavy metals, firstly, I would like to concentrate on lead, because lead is the most toxic heavy metal, especially mainly concentrating to children's, because kebab powders and kebab is morely, for children are more fond of this kebab. So this may affect their IQ level. We found it ranges from 0 to 18, but the permissible level is 10. We found that it is exceeding the permissible level. So in children, it mainly affects to their IQ system, IQ, and it causes hearing defects, and learning disabilities may also be caused, and it affects the neurological system, and it also affects hematological system. And coming to adults, it mainly causes memory loss, headaches, and constipation. Especially in the females, the constipation can be observed, and in the neurologic. And coming to nervous system, it causes numbness. It is a big disorder, and in men, it is mainly affecting the reproductive system, and kidney damage may also occur. So cardiovascular system is also affected, and mainly exposure to lead is mainly affecting the body metabolism. It makes us weak, and it disables us from being more active. So I think so lead must be banned, because lead should not be it is not at all necessary for our system, and this high levels may seriously affect on our immune system and on our body. Next, moving on to another toxic substance, it is lead. So lead, it is like mimicking, it mimics, like it acts as zinc, but it does not makes the function of zinc, it just acts as zinc. So this we found that cadmium was higher than the permissible level. It mainly affects the cardiovascular system, and it mainly affects our blood vascular system, and it also causes kidney loss, and bone strength will be reduced from this. And another main disease is osteoporosis is also caused from this cadmium exposure. So next, moving on to rubidium and molybdenum, this both are rubidium. It's not at all. It does not has any biological function in our body, but it's just a part and parcel of heavy metal. But it has it mainly works in the stimulatory function for the metabolism. And the collected samples we found from 10 to 40, which is above the permissible level. And molybdenum is very, it's a cofactor which is used for the synthesis of 4 important enzymes in our body. Next, in the collected samples, it found from 15 to 35. It is also above the permissible level. And molybdenum deficiency and its toxicity is rare, because molybdenum is it's a part and parcel, like it will be along with in our food products. Next, I would like to conclude that from our study, we are not opposing the use of spices. We are mainly concentrating on the heavy metals which are affecting the humans for their health, and which are affecting children, especially for their IQ level, for their it affects for their IQ level, because today's children are very much necessary for the future generation. And spices play a very spices, even though they are having the medicinal properties, the way that they grow spices, it depends on the way that they grow spices. They the way that they use for manufacturing the powders, everything matters here. So this awareness must be created to the consumer, so that they will be aware of this. And mostly they have to avoid the roadside food, because we don't know what kind of powders they are using. And usually everywhere in our house we'll be using packed. actually we also observed that we made a homemade kebab powder, and we also observed the concentration of metals in that. And apart from that, we collected the powder samples in the which is widely used in Bangalore. So we observed that the homemade kebab powder is very much healthy and it's very easy to prepare. So I insist all the kitchen holders of the house that are mothers, they must insist to prepare homemade kebab powder, and they must use that, because especially for the children it is affecting more. And we also have some live examples uh, around us. So I would like to conclude like this: so go back to healthy food, limit your fast food, otherwise it will be your last food. Thank you.
Thank you, Vandana, for bringing this awareness in people. Thank you very much.
Thank
Shashi
you,
ma'am.
ma'am.
Yeah, Vandana, thank you so much. Can you just switch on your video? Yes, Vandana, hi. Okay, great. So you are at home and giving this presentation. So nice of you. And when you talked about all those who are talking about the kitchen, I'm
Yeah,
asking
ma'am.
you, hello, can you hear
Yeah,
me?
ma'am. Yeah, ma'am.
So I'm just curious to know how much you at a personal level
Yeah, ma'am.
avoid the street food, because I will not say you are not having it. You are definitely having it, but how much are you able to avoid it?
Ma'am, actually, what we do means in this lockdown, we have learned many foods to make at home, and seeing YouTube, as you all know, social media is helping us to learn how to do street foods at home. So I insisted my mother and my neighbors to use homemade kebab powder, and I also told them how to make it at home, because spices, we get the spices, but during this manufacturing, if there is a defect for our health, so why don't we insist or persist to make our homemade powders, so it will be healthy. Because usually sambar powder, garam masala powder, they will be preparing at home only, ma'am. According to my surrounding, as I know, they'll be preparing at home. But when we come to this non-veg, they'll persist. Oh no, it will it will be very colorful. It will be very colorful. It will be very tasty. If we make at home, we won't get. So even first, I did my own experiment, ma'am. Even though the color was slightly different, ma'am, so red we won't get. Okay, it was okay, ma'am. Not to that. Prevention is better than cure, no, ma'am. So without exploring to lead such heavy metals, so we can just do at our home itself.
I really appreciate your enthusiasm and the connect to the project. Thank you so much for sharing your
Thank you, ma'am.
knowledge. Thank you.
Thank you, ma'am.
Thank you.
Thank you, Vandana, for emphasizing on using homemade products. Now we'll move to the next participant, Prakruti. Are you ready?
I will be sharing Prakriti's screen, her presentation I'm sharing. Can I do that?
And please ask Prakriti to switch on the video.
Yeah. Prakriti? Prakriti, are you there? Prakriti, join now. Yes, are you not able to speak?
Yeah, ma'am.
Okay, increase the volume.
Hello, ma'am.
Pardon me?
Yeah, ma'am. Are you able to hear, ma'am?
Yes, but you have to be a little louder.
Yeah, sure, ma'am, sure.
Yeah. You are presenting a poster, right?
Yes, ma'am, yes, ma'am.
And please ask her to switch on the video.
Prakriti, please switch on the video.
Yes, we are able to see the screen. Yes, Prakriti, you can proceed. The screen is shared. Yeah.
Thank you, ma'am. Good morning to one and all present here. My name is Prakriti. I'm studying in RRDCH, and my topic is the role of dentistry during the COVID-19 pandemic. Coming to the emergence of the highly
Prakriti, sorry for interruption. Can you just be increase your volume? It is very low.
Now, ma'am?
Okay.
You can just be a little louder, come closer and be louder.
Yeah, sure, ma'am. Sure, ma'am.
Yeah, that's better.
Yeah, okay, ma'am. Due to the emergence of the highly infectious novel coronavirus SARS-CoV-2 has led to the global COVID-19 pandemic. Since the outbreak of COVID-19, worldwide healthcare system has been severely challenged. Hence, it is commendable that many dentists have risen to the challenge in the fight against COVID. Though dentists and the physicians have different slopes of practice, their trainings share many similarities. Licensed dentists are eligible to administer to COVID-19 diagnostic tests such as the nasopharyngeal and the oropharyngeal swabs. Due to the COVID outbreak, as well as the harsh lockdown practices worldwide, have created a stressful situation for many of the people globally. Due to this stressful situation, as shown, may have led to the poor oral health and hygiene. Additionally, with the growing evidence of the asymptomatic transmission of COVID-19, infection control practices should be re examined and improved to prevent the cross infection in a dental setting. Now, some coming to the occupational health and safety. Volunteers working in close contact with COVID 19 positive patients should check for the proper fit and size of N95 masks. Not all the volunteers have the same physical as well as the mental stress, and the amount of volunteering the work that one can engage must be monitored by the group leaders and the higher level authority. So, some of the precautionary measures for the dental practitioners to be followed is like wearing the eye protection along with the face mask to ensure the eyes, nose, along with the mouth are being protected from the exposure of the respiratory secretions, that is, the splashes as well as the sprays. And usage of your N95 respiratory along with the face shield to be used, and also the proper ventilation and high evacuation suction along with the rubber dams to be used for the isolation along with the proper infection control, along with the PPE kit, which is the personal protective equipment to be used in order to protection from the patients. And coming to when the patient has entered a dental clinic, the first and the prior thing to be done is screening of the patient, as where there is an increase of temperature, body temperature or not. And later, being disinfected by the 0.1% of the sodium hypochlorite. And the patient is later then made to undergo the procedure. And when they're the extraction of when coming to the extraction of minor oral surgical procedure under the local anesthetics, where there should be an avoiding of your intermediate spitting by the patient, and use of the high vacuum suction, and use of the micromotor at the low speed and the slow drip irrigation, frequent cleansing of the doorknobs along with the tables. So after the dental procedures being over or completed, there should be a decontamination to be done. So the water, water, detergent, and 0.1% of sodium hypochlorite solution is needed for the proper disinfection. The door handles and surfaces are to be frequently touched and need to be mopped. So wiping and disinfection is a must. And the instrument which has been used during your dental procedures has to be disinfected and sterilized. And there should be a proper disposal of the equipments or the instruments being used. I would like to conclude saying that at last, we should not, the dental practitioner should not consider as COVID-19 as an occupational hazard, but should have a strong mentality in order to overcoming that and creating awareness along with the campaigns to prevent the transmission of this virus. lastly saying that touch me not, which is the key for the prevention of transmission of virus to be done. And thank you, ma'am. And I would like to thank my teacher, Shamla ma'am, for guiding me. And thank you, everyone and all.
Very nice, Prakriti.
Thank you, ma'am.
And I really appreciate that you have given a very strong message of saying that don't take COVID as an hazard, but rather keeping that taking adequate steps and having a very positive frame of mind and continuing your whatever the profession you are doing, whether it's practicing doctors or students like you who use this opportunity to showcase their own work. I really appreciate that. Thank you.
Thank you, ma'am.
Thank you, Prakriti. Now we'll move to the next participant, Pramati.
There she is.
How COVID has affected. My name is Raghavendra. I study in IRA Academy 5th standard. Today I would like to present to you how COVID-19 has affected children's life. Children are not affected much by the virus, but it has changed our life in big ways. All children across all countries are affected. No playing, so no physical workout. No school, so no learning. Always at home, so very bored. Not meeting friends, so unhappy. No eating outside food too. Always wearing mask, which is so irritating. High income family kids, they have their parents to they have their parents to help them with studies, and they work from home. They have access to online classes, and they have gadgets and toys to play with. But kids from low income families are affected because they have no gadgets, so their parents are not at home. COVID led to malnutrition. Lockdowns have impacted in us getting nutritious, fresh, and affordable foods. This has led families to rely on nutrient poor alternatives, leading to malnutrition, especially in children. COVID led to no free school meals. School isn't just about learning. For so many children, school is where they receive their only meal of the day. At the peak of COVID-19 pandemic, nearly 370 million school children from low to high income countries are missing out on school meals which they depend on. COVID led to broken education. The COVID-19 pandemic has affected education systems worldwide. Closures of schools, universities, and colleges. Without gadgets, poor children are missing learning. This is breaking education system, leading to child labor and child abuse. As you can see, we have the world's map here, and the red markings is where the schools are completely closed. And these are all developing countries. Education is affected more in developing countries like ours. COVID led to mental health issues. During lockdown, young children's mental health has suffered. Clinginess and worrying has increased in children. These are mainly due to loneliness, fears about the coronavirus, not meeting friends, no school. Online classes are also affecting children. Students with headaches and eye issues. COVID has also led to vaccine disruption. Around 80 million children under the age of 1 are at greater risk of diseases such as mumps, as COVID-19 has disrupted vaccine campaigns. before I end the, I would like to end the PPT. I would like to end the PPT by telling you how you can support your children. Talk to us about the COVID-19 outbreak. Reassure that we are safe. Let us know that it's okay to feel upset. Help us to keep away from social media. Help us to keep up with our regular routines to avoid COVID distractions. Connect with friends and the larger family members. Spend time with us in meaningful activities, reading together, exercising, playing board games. Thank you.
Wow, Paramiti, it's really nice. Are you really in class 5?
Yeah.
Okay. And what inspired you to make this presentation?
My mom.
Okay. And what's your mom doing?
She's a dentist.
Ah, okay. She's a part of this group?
Yeah, Shamala.
Ah, that's how the bright star is coming. So good, good, good. Very nice, Ramati. And I really liked it because you presented the child's viewpoint on that. Otherwise, as an adult, we were telling that this is so stressful and all, but for children, the disease is not stressful. The most stressful is being alone, being not able to play around with your friends. And I really appreciate that you brought your mom's vision and dream really true by making this presentation, because you are very confident, as confident as your mom, rather more than that. At this age, I don't know how she was, but what you are is awesome. Too good. Thank you. Thank you for sharing.
Thank you.
Thank you, ma'am. Thank you. Thanks for the sweet words. Thank you.
Thank you, Pramati, for the beautiful presentation and figuring out all the problems faced by the little kids like you. It was an excellent presentation.
Thank you, ma'am.
Now, I would like to take this opportunity to call upon Dr. Geeta Vishwanathan, Madam, to give her views on tackling mysterious viruses and their related health issues. How prepared are we on today's topic? Over to you, Madam.
Is Geeta ma'am is able to connect? Shamla? Is Geeta ma'am is able to connect?
Ma'am, Principal sir is calling Geeta Madam, and Madam is not receiving the call.
Yeah, because she is having some network issues, and that's why she was not able to be here. And unfortunately, we will not be able to see her face. So
Madam
maybe
has received the call, ma'am.
okay, lovely.
That is
So I think
completely
on
fine.
call only we can just hear a beautiful voice and get guidance from her.
Yes. Go ahead.
Okay. Hello.
Yeah.
Greetings and my best wishes to all of you. I'm very happy that the whole thing is going on very well. Unfortunately, we are online and it was used to be a lot of gala preparation and we used to have lot of very good speakers and lot of presentations in the previous years. Because of the present situation, we are sticking to this kind of online, all of you know. And I'm really very, very happy to know the whole team, Dr. Prakash and his team, Dr. Shamla and Dr. Shashi Chowdhury, and the others whom I don't remember. All of them are doing very well. Presentation. Now, the network problem, a lot of disturbance for me. I'm not able to come on the video audio session. Now, what I just wanted to share with you only small one thing. Now, all of us are looking for well-being of the future generation. So our main motto is that our future generation, younger generation, should be much more healthier and they should survive in a very better environment. For that, all these constraints are happening. Now, the thing is, with all advanced technology, I'm sitting in my home and speaking to you, and you people have gone through all the presentations and everything. We say that technology is connecting us to the core and technology is taking us to moon, Mars, everything. But unfortunately, technology is not able to find a vaccine or a remedy to this unknown virus, unseen virus, the microscopic virus. I wish technology leads to that and save the present population and also the future population. That's my only wish. And also, I wish all the team, all the staff, all the participants, whoever has come on to the our website and registered and who are online, and many of my friends are online. They just messaged me. We could get into that for some time, and I'm very happy all over. Everybody is doing well, and I pray God that we return back to the normal, and we have the next year seminar in a very gala time. We had very nice thing with AMC College and Dr. Prakash and his team. Hope that we will be able to do that next. I wish you all the best, and my prayers and my good wishes are always with you. Thank you, my dear all.
Thank you.
Did Vijayalakshmi madam speak to you?
Yes. Morning.
Morning, she also called me. She said I'm not able to come on.
Thank you very much, madam. Now, I would like to call upon Dr. Shashi Chowdhury, ma'am, trainer and educationalist, New Delhi, for summing up today's event and to give a conclusion on today's webinar. Over to you, madam.
I hope you all are able to see me.
Yes, ma'am.
Yes, and are you able to hear me correctly?
Yes, ma'am.
Super. So first and foremost, I'm really thankful that, I like the way you said, I'm Shashi Chaudhary from Delhi, and on behalf of Ayur Suraksha and the entire fraternity of AMC institution, first of all, I extend my most sincere thanks to the Almighty God for making today's event a resounding success. With His blessing and grace, we are able to make this event what it was. And I really feel privileged in proposing the vote of thanks and acknowledging the contribution of those who worked really hard to make this celebration happen. To begin with, I really first and foremost would like to extend my real hearty vote of thanks to our chief guest, Dr. Girish, who spared time from his busiest schedule to grace the occasion. Today we had an opportunity to hear his thoughts, and this will surely be going to encourage us and our participants in future. It was really very different way, the way you put up the whole situation, sir. I'm really thankful to you. And the thoughts which you shared has really enlightened our mind, has shown us a new path. And my gratitude to all the speakers for gracing the occasion and sharing their thoughts with us. I'm immensely thankful for Dr. Prakash, who needs no introduction. And even if I try to appreciate his work, I am short of words because the words cannot justify the feelings. I'm really thankful to him and the kind of involvement which he just, it's like he is there not to worry. And his efforts toward making this arrangement was awesome. And the first thing, it's our first online webinar. And then our Dr. Geeta, the lovely and Dr. Geeta Vishwanathan is not able to join. We are missing her. At the same time, with Dr. Prakash, he's doing everything just to make the things happen the way she wanted it to happen. And I'm really thankful to be in the company of Dr. Prakash. And it gives me an immense pleasure to appreciate the contribution of Dr. P. Sudharani, Head of Department Biotech, AMC. It's like the way she just very comfortably comes and is full of knowledge, and the way she is open to share. I met her personally, and I know how good person she is. I need to mention my deepest sense of appreciation to MS Pavitra, whose facilitation skills in the webinar has made webinar run smoothly. It was effortlessly, flawlessly, the comfortable transition of Pavitra, your skills, the way you conducted is, thank you so much. We are so far off and we can't do it. And there you are, just bang on, doing everything, making everything possible. I also extend thanks to all the staff members of AMC for the enormous cooperation within the organization and with us as a Ayush Suraksha to make this thing happen. And friends, I must say that an event like this cannot happen overnight. The wheel started rolling weeks ago, in fact, months ago, and it required planning and a bird's eye for details. We have been fortunate enough to be backed by the team of very proactive and dedicated who were well versed in their job. And now I take this opportunity to thank Mr. Mohan and his team members. I'm short of words for their involvement and their willingness to take on the completion of tasks beyond their comfort zone. All the flyers, the brochures, and the certificates, everything is done by them. They might not be able to be here, but yes, their presence is always felt with us, and we really miss this face-to-face interaction in any case. I specially mention my thanks to Dr. Geeta Vishwanathan and Dr. Vijay Lakshmi for being the catalyst that stimulates us to do our best and standing as pillars of strength. With a deep sense of appreciation, I thank our lovely organizing team members for their untiring efforts. No, I'm not, consciously missing out their names, but I feel if I name them, even they'll feel very, different. But still, Guru Siddhesh, his best partner, Shamla, Dr. Shamla, Dr. Shweta, they just do it and they don't mention it. And that's the beauty of Ayush Suraksha's annual conference. And today, the way we were having it first time online, everybody was nervous. I don't know what will happen, how the things will happen. But the kind of effort they quietly do, I mean, it's so much to learn from their behavior. I really salute them. And I find them is like they are walking, talking temples. The kind of feeling you get when you visit to a temple, the same feeling I get when I talk to Dr. Shamla, Dr. Prakash, Dr. Shweta, and other eminent. I mean, it's like you just talk to them and you feel, wow, such a calmness and serenity they have, such a purity in their thoughts, such a dedicated work they are doing. And I also like to thank the people who worked behind the scene to make this event happen. Our technical arrangement team, stage setting, and the other aspects like Mr. Ranjan, Abhijit, and Dolwin. And not to forget, our sincere gratitude go to all the parents and the well-wishers of our rock-solid support system and encouragement. Without their support, the children will not be able to achieve that excellence. And how can I miss Dr. Shamla's daughter presentation? How can I miss others who have really talked about coming from their heart? Because during the lockdown, they understand the value of the family. And I'm very glad to report right now the kind of presentation it has come from the heart. Because otherwise, teachers were there, but they were on a virtual thing. But this is something the families need to be applauded. And I really applaud for that. And thank you so much for that. And finally, I would like to thank our rock stars, our participants who made this event so joyful with their impressive presentation. I mean, look at the way they make the presentation. Look at the passion which with this, present their presentation. It's really awesome. They're giving us different viewpoints. Somebody who is reporting an experimental study which was conducted in lab. Another one who is talking about differentiating in the society, lower socioeconomic status, higher socioeconomic status, how these children are doing. They are telling, one is telling about the adult viewpoint, another is telling about the child's viewpoint. The same issue handled in a different ways. So honestly, we are blind. From the adult point, if we see, we are blind to child's need. And if from the child's viewpoint, if we see, we are children are blind to adults' need. And then the professionals who are working on the ground to help people to really be there without stopping it. Like I have come to know that so many professionals have not gone back home and they were just serving people. So, and then there are people who are working for to find the vaccine. I mean, the kind of passion these rock stars show, I really put thumbs up on their effort. They're really awesome. And I would like all the panelists to give a huge round of applause to our rock star. Yes. So now all the presentations were really good and I enjoyed each and every one which was presented there. I might not be able to, have words to express my gratitude because with every presentation I was feeling speechless. Kind of the passion they were showing, no matter whether they're still sitting at home or they are using the virtual screen or using the real background, the level of confidence, the spark in their eyes really mesmerized me. And I was like, how can I say anything to them? They for us. So for this time, they all are winners for us. Everyone will get the certificates. They are not going to rate one or first or second or best. Like best on what criteria? The reference point has changed. So this, with the new normal world, I'd really would like to announce that this time, all the participants for us are rock stars. They are brilliant. They are outstanding because during this COVID time where so many people are facing a lot of worry, stress and tension, they came out with flying colors and break their barriers and face the camera and they were ready to share. That is where the quality of having a good mental health. And this is where I really applaud them and thank you them for being there. Because if the students are there, participants are there, only then the webinar has a meaning. Thank you so much. So last but not the least, a big thank you to each one of you who made this annual webinar memorable for all of us. Please accept my apologies in case I missed out any name. Once again, I, Shashi Chaudhary, on behalf of Ayur Suraksha, thank you all for your virtual presence and live presence. Thank you so much. Thank you. Over to Pavitra.
Yes, thank you very much, madam, for appreciating all the participants and for patting each one of us and motivating us to do further better. So thank you very much, madam. So before winding up this webinar, I would like to bring it to the notice of all the participants. The feedback form will be sent within 24 hours of this webinar. As we have come to the end of the webinar, I would like to thank Almighty, first in place, for making today's webinar possible. I would like to propose hearty vote of thanks with immense pleasure to our guest speaker, Dr. Girish Hetsi, for accepting our invitation and devoting his precious time by giving an insightful presentation on COVID-19. My heartfelt thanks to Dr. Geeta Vishwanathan Madam and Dr. Vijayalakshmi Deshmani Madam, founders of Ayur Suraksha, and to the organizing and scientific team, Dr. DVSSR Prakash, Principal, Administrative Management College, Dr. Shashi Chowdhury, Trainer and Educationalist, New Delhi, Dr. Shamala Karnam, Associate Professor, RR Dental College, Bangalore, Dr. Guru Siddesh, Bangalore, Dr. Shweta, Faculty Member, NPS, Bangalore, and Mr. Mohan, Bangalore. I would like to thank Mr. Rahul Kalluri, Executive Vice President of AIMS City Group of Institutions, and all the members of the management for their great support. I wholeheartedly thank Dr. DVSSR Prakash Sir, Principal, Administrative Management College, who continues to inspire us to work with zeal and enthusiasm. I extend my gratitude to Dr. P. Sudharani, HOD of Department of Biotechnology, AMC College, and Professor Rajesh Kumar, Director, Hotel Management Department, AMC College, for being a part of this event. I heartfully thank Mr. Ranjan Narala Shetty, Department of Commerce, Mr. Avijay Chatterjee, Department of Hotel Management, and Mr. Dolvin, sir, for their kind cooperation in helping us with all the technicalities and the smooth conductance of this webinar. My special thanks to all the scientists, academicians, students, research scholars, and faculty members for making this webinar more colorful with your presence. We have been organizing conferences in association with Ayur Suraksha, Bangalore from past 6 years. And this year, we made it happen through webinar due to COVID-19 pandemic. Next year too, we will come up with some more fascinating topics, and I request all the participants to join us with the same zeal. Thank you. Thank you all.
Thank you all for your presence and participation. Thank you.
For all the participants, this is just the last announcement that all your certificates will be sent within a week's time. All the participants and presenters